Meet Sarah, a vibrant 28-year-old graphic designer with a passion for creativity and a zest for life. She loved her job, thrived on deadlines, and was known for her infectious laughter that brightened up her workplace. But everything changed in a matter of days, turning her world upside down. What started as a few odd moments soon spiraled into something much more serious. One Monday morning, Sarah arrived at work feeling unusually foggy, struggling to remember simple details she once handled with ease. She brushed it off as stress, but the confusion only deepened. By midweek, her speech became jumbled, her sentences disjointed. She seemed lost in time, convinced she was still in college, unable to recognize her present surroundings or even her colleagues. Alarmed, her family rushed her to the ER as Sarah grew paranoid, agitated, and unable to sleep for nights on end. The person they knew seemed to slip away before their eyes. Doctors were baffled. Her physical exam was normal, but her mind was unraveling rapidly. Soon she developed seizures, and her condition deteriorated further, leaving everyone searching for answers. Her loved ones watched helplessly as Sarah's vibrant personality vanished, replaced by confusion, fear, and a haunting sense of loss. The hospital room became their new reality. This isn't a rare TV drama. It's the reality for thousands each year diagnosed with autoimmune encephalitis, a disease that can strike anyone, at any time, without warning. Sarah's story is a powerful reminder of how quickly this disease can strike, turning a healthy, active mind into a medical emergency almost overnight. Families are thrown into chaos, desperately searching for answers and support as their loved one changes before their eyes, feeling powerless and afraid. The suddenness is shocking. One day, life is normal, and the next, you're facing a neurological crisis that no one saw coming. Understanding this brain on fire is the first step toward hope and recovery. With awareness, early diagnosis, and the right treatment, there is a path back. One that starts with recognizing the signs and never giving up hope. To understand Sarah's ordeal, let's break down autoimmune encephalitis. Encephalitis means brain inflammation, like swelling from a cut, but inside your brain, disrupting everything from memory to movement. Autoimmune means the body's defense system mistakes its own cells for enemies. Instead of fighting viruses, the immune system attacks healthy brain tissue. The result? The brain's signals become scrambled, causing severe neurological and psychiatric symptoms. This is different from infectious encephalitis, which is caused by viruses. In autoimmune encephalitis, the threat comes from within. Recognizing this difference is crucial. It guides doctors to the right treatment. The body's own protectors become the attackers, and only targeted therapy can stop the assault. That's why early, accurate diagnosis matters so much. Understanding the cause is the key to saving lives. The immune system is our body's defense, a complex network designed to protect us from harmful invaders like bacteria, viruses, and other pathogens. It works tirelessly, day and night, to keep us healthy and safe, identifying and neutralizing threats before they can cause harm. One of its most powerful weapons is the antibody, tiny proteins that seek out and destroy anything that doesn't belong in the body, targeting threats with remarkable precision. But sometimes, this system goes awry. In autoimmune encephalitis, the immune system malfunctions and mistakenly produces autoantibodies that attack the brain's own neurons, confusing friend for foe. These autoantibodies target specific proteins on the surface of brain cells, such as the NMDA receptor, which is essential for memory, learning, and judgment. When these vital proteins are blocked, the brain's normal functions are disrupted. As a result, communication between brain cells breaks down, leading to a cascade of neurological problems that can appear suddenly and progress rapidly. The consequences can be dramatic. Patients may experience confusion, seizures, hallucinations, or sudden and severe changes in behavior, often leaving families and doctors searching for answers. The immune attack triggers inflammation in the brain, which not only damages neurons, but also attracts even more immune cells, amplifying the injury. It's a vicious cycle. Each wave of inflammation causes more damage, which in turn draws in more immune cells, making the situation worse with every passing hour. This internal war can devastate the brain in just a matter of days, leading to lasting disability or even death if not recognized and treated quickly. That's why stopping the immune attack as soon as possible is absolutely critical. Early intervention with immunotherapy or other treatments can halt the damage and give the brain a chance to heal. The sooner doctors recognize the signs and begin treatment, the better the chances for a full recovery and a return to normal life. Autoimmune encephalitis is a true medical emergency, not just a psychiatric crisis. Rapid diagnosis and action can make all the difference. With urgent intervention, patients can recover, families can find hope, and lives can be saved from the devastating effects of this hidden battle within the brain. Autoimmune encephalitis doesn't discriminate. It can strike anyone, any age, any background. While some types are more common in young women, cases occur in children, adults, and the elderly. This wide reach makes diagnosis tricky. Symptoms often mimic psychiatric disorders or dementia. Misdiagnosis can delay life-saving treatment, allowing brain damage to progress. That's why sudden, dramatic changes in personality, memory, or behavior should always prompt a search for physical causes. Awareness among doctors is vital. Autoimmune encephalitis must be considered when the mind unravels suddenly. No one is immune. Vigilance saves lives. What triggers the immune system to attack the brain? Sometimes a tumor, like an ovarian teratoma, contains brain-like tissue, prompting the immune system to make antibodies that also attack the real brain. In other cases, a recent infection tricks the immune system through molecular mimicry, where antibodies meant for a virus also target brain cells. Frustratingly, many cases have no clear trigger, no tumor, no infection, just a sudden, unexplained immune attack. Genetics and unknown environmental factors may play a role. Regardless of the cause, the treatment focus is the same: stop the immune assault. Identifying a trigger can guide therapy, but acting fast is always the priority. The mystery of the cause doesn't change the urgency of care. Autoimmune encephalitis strikes fast, days or weeks, not months or years. Sudden memory loss, confusion, and dramatic personality changes are common first signs. Patients may become paranoid, hallucinate, or act completely out of character. Seizures and strange movements, like tremors or repetitive motions, often follow. Speech can become jumbled or nonsensical. The body's automatic functions, heart rate, blood pressure, temperature, may swing dangerously. Sleep is often severely disrupted. These symptoms can look like psychiatric illness, but the rapid onset is a red flag. When these signs appear together, especially in a previously healthy person, it's a medical emergency. Immediate action can make all the difference. Diagnosing autoimmune encephalitis is detective work. No single test gives the answer. Doctors start with a detailed history and neurological exam. Brain MRI may show inflammation but can be normal early on. EEG detects abnormal brain activity or hidden seizures. The key test is a lumbar puncture, analyzing spinal fluid for inflammation and specific autoantibodies. Blood tests help rule out other causes and may also detect autoantibodies. If a tumor is suspected, body scans search for hidden growths. Each test adds a piece to the puzzle, guiding doctors toward the right diagnosis. Speed is crucial. The faster the diagnosis, the better the outcome. Early recognition and testing save lives. Once diagnosed, treatment must start immediately. First-line therapies include high-dose steroids, IVIG, and plasma exchange to remove harmful antibodies and calm the immune system. If these aren't enough, second-line drugs like rituximab or cyclophosphamide suppress antibody production at the source. If a tumor is found, removing it is essential. It stops the antibody factory. Treatment is aggressive and multi-layered: remove antibodies, suppress their production, eliminate triggers. The goal is to halt brain damage and give the patient the best shot at recovery. Every hour counts. Delays can mean permanent loss. Early, targeted therapy is the difference between lasting disability and a return to normal life. This is a race against time, and every step matters. Surviving the acute illness is just the beginning. Recovery takes time, patience, and a strong support system. The journey forward can feel overwhelming, but every small step matters. Family, friends, and dedicated healthcare professionals all play a vital role in helping patients rebuild their lives after such a storm. The brain needs months, sometimes even years, to heal and rewire itself after autoimmune encephalitis. Healing is a gradual process, and progress may be slow at times. Each day brings new challenges, but also new opportunities for improvement and hope. Rehabilitation is key. Physical, occupational, and speech therapy help patients regain lost skills and independence. Therapists tailor exercises and activities to each person's unique needs, helping them relearn how to walk, talk, and manage daily routines. This teamwork is essential for rebuilding confidence and ability. Neuropsychologists assist with lingering memory and thinking problems, offering strategies to cope with cognitive changes. Emotional support and counseling can also help patients and families adjust to a new normal. Regular follow-up with specialists is crucial to monitor for relapse, manage medications, and address any new symptoms. Ongoing care ensures that setbacks are caught early and that treatment can be adjusted as needed. Recovery isn't always linear. There are ups and downs, setbacks and breakthroughs. Some days will be harder than others, but with perseverance, progress is possible. Keeping a journal or charting milestones can help patients see how far they've come. Many, like Sarah, are able to return to work, school, and family life, thanks to early recognition, timely treatment, and ongoing support. These stories of resilience inspire hope for others facing similar challenges. The most important message: don't ignore sudden, unexplained changes in mind or behavior. Early action can make all the difference in recovery and long-term outcome. Seek help, advocate for a thorough evaluation, and push for answers. Trust your instincts and don't be afraid to ask questions or seek a second opinion if needed. Awareness saves lives. Sharing knowledge with others can turn tragedy into hope. By spreading the word, you empower others to recognize the signs and seek help sooner. With the right care, resilience and recovery are within reach. Every story of healing is a testament to the power of hope and determination. Autoimmune encephalitis is a challenge, but not a life sentence. With support, treatment, and time, many people reclaim their lives and dreams. There is hope after the storm. Recovery is possible, and a brighter future awaits.